Hello sir, we have a question for you. One of our subscribers recently visited her dentist and was informed about her bone loss in her lower front teeth. She was told that she could undergo a flap surgery, but it may not last her long enough. What do you think could be the possible treatment options?
Okay, thank you for the question. Now when it comes to lower anterior teeth, if you look at most often, the lower anteriors is where we find the maximum bone loss. And the reason being, one is of course the lower anterior teeth, we have the frenum, the lower labial frenum, which can have a lot of pressure on our lower gums. And also the lower front teeth is where the maximum plaque and calculus deposit also happen. So because of these two reasons, there are a lot of chances that there is a lot of bone loss that can happen here. So now let's look at one of the example where we are having a look at the scan of a particular patient here, where we can actually see the lower front teeth with a lot of bone loss. So this is actually a CT scan. If you look at it, this particular area where there is complete bone loss that has happened in the lower front teeth, where the lower front teeth are almost fully out of bone, and just the little canines are having some bone. So now in this instance, so this is, even though it's not that X-ray of that particular patient whom your question was asked, this is something similar to it. So how do we go about deciding what all things that can be done? So now, first is what we need to understand is, so this is where the importance of frequent dental visits come in, right? So when we are able to frequently visit the dentist, we can identify this problem happening at a very early stage, get a lower, cleaning or a curettage done, then we will be able to save the teeth without extracting. And of course, when it goes to a little advanced level, we can always do a flap surgery, if required, do a bone grafting to save the teeth. So these are the two procedures which are usually done: a cleaning, a deeper cleaning and a curettage, or a flap surgery, or some of the procedure that can be done to save the teeth. But usually what will happen, when you leave it to a very advanced level, the bone loss on those teeth becomes quite significant. So when those bone loss on those teeth becomes quite significant, what can happen is any treatment, like reparative treatment done on that area, will not be effective. The reason it won't be effective is when you are doing a procedure, of course you will be able to clean it completely, but it is almost always impossible for the patient to keep that area clean. So the patient is not, the area is not favorable to keep the area clean, or always the same problem will keep happening again. So in that instance, it's always better to extract the teeth and then get dental implants done. So there is another reason why extraction of the teeth might be indicated. So always when I do a treatment plan, or when I look at the patient X-ray, if the particular teeth is going to function well in the patient's mouth for more than 5 years' time, I would always prefer to save the teeth. But in instances where those teeth are not going to come for that amount of time, sometimes it might be better to extract the teeth. The reason being is, when tooth loss happens because of mobility, not only tooth is lost, the bone that is supporting the tooth is lost also over a period of time. To prevent the bone loss, when we extract the teeth and then do an implant, to start with itself, we have better bone to do implants. So that's one of the, a very simple reason why we would want to extract the teeth and then do dental implants. So to answer simply, extraction of the teeth is perfectly fine if those natural teeth are not going to last in the mouth, with good treatment for more than 5 years time. Even with treatment, if they are not going to last for 5 years time, then extraction and implant will be the best choice. Hope you like this video. If there are any questions, do ask in the comment section below. Until next time, this is Dr. Arun from Pearls Dentistry. Bye bye and thank you.
வீடியோ பிடிச்சிருக்கா லைக் பட்டன் கிளிக் பண்ணுங்க, சப்ஸ்கிரைப் பண்ணுங்க, பெல் ஐகான் கிளிக் பண்ணுங்க. இந்த மாதிரி வீடியோஸ் உங்களுக்கு வரும். Thank you.